Hi, I'm Mel Pickup, Chief Executive of Bradford Teaching Hospitals, and welcome to the weekly news roundup from across the Trust. This week I'm outside our vaccination hub because inside we're rolling out the COVID booster jab to our colleagues. More about that in a moment. And also today the launch of a new wellbeing and development one-stop shop for staff so that we can help our colleagues thrive at work and beyond. And we have news of a trainee physiotherapist scheme designed to give new starters some real hands-on experience. But first, with COVID-19 an ever-present issue, it's so important that staff receive their booster jab. This is not only to protect them, but also their patients and their families. Here's Associate Medical Director Paul Southern, who's been jointly in charge of the vaccine programme, to tell us more.
Lots of our patients are vulnerable. Not all of them can have the vaccination, and in some of them the vaccination is not terribly effective. In those situations, the people around them being protected from COVID is the most important thing we can do. We don't really understand how long the primary course lasts for, and that's why it's critically important that all staff get a booster vaccination as soon as it's offered. This will mean that we can really effectively protect our colleagues and our patients from COVID-19 in the coming winter. So whilst the vaccination is really important, let's not forget the other really basic things that we can do. Wash our hands, keep distance with other people, wear masks when appropriate. These are really important. Alongside that, don't forget about other viruses. Think about things like the flu jab. When you're offered it, take it up. It'll protect you, your family, and other people.
Thanks, Paul. That is such a vital message. Now, as you can imagine, working in the NHS over the past 18 months has been really tough. We always do our best to look after our amazing staff, but we wanted to develop something more formal to support their well-being and their development. So say hello to Thrive, an online one-stop shop of information and resources, and it's so much more too. Here's Head of Organisational Development, Kat Schutt, to tell us how it works.
We've been listening to staff throughout the pandemic, and with winter approaching, we know it's going to be a really challenging time. So we want to make sure that our staff offer is as good as it can be. Thrive is our way to do this. Thrive includes things like wellbeing, both mental and physical wellbeing, as well as support for families, carers. Other things include development opportunities, that might be coaching, personal professional development, as well as opportunities for staff to have their say on the things that are really important to them. Colleagues will find a QR code that they can scan. The beauty of Thrive platform is that anybody can access it through any device. So that might be a personal mobile or a work computer, laptop, tablet. Thrive is all about creating a community where our people can learn, grow and reach their full potential. If we can support staff, it'll have a better impact on patients and patient outcomes.
Thanks, Kat. Colleagues can access Thrive via the link on screen now. Now let's take a look around the rest of the Trust to see what other news is hot off the press.
Spread kindness and show our patients and our visitors how kind our staff are, and spread that kindness not just in the hospital but out as well.
Transformed by the patients on Ward 30 and the place specialists. They've made some fantastic scarecrows, some squirrels and hedgehogs, and it's all to celebrate the start of the autumn season.
Thanks, Helen. What a lovely way to say goodbye to summer. Finally, we are always looking for innovative ways to deliver training to our new team members. One way is a pilot scheme that we're running to give physiotherapy students the full 360 degree of experience of running a clinic. It's hoped that this will help attract more physiotherapists into the profession and improve their skills to meet the demands on the service. Here's physiotherapist James Davenport and student physiotherapist Isabel Chow to tell us more.
We've been tasked by Health Education England to increase the numbers of students that we can take on from allied health professionals. So this is a way that we can try and increase capacity whilst maintaining safety. The students have a quality placement, they have the opportunity to learn skills and underlying knowledge from a qualified member of staff, and ensures that they are ready to take on the work when they qualify as physiotherapists.
Musculoskeletal is the biggest area of physiotherapy, and a lot of patients come with lower back pain, and lower back pain patients tend to affect their lifestyle and work. So it is important for students to have that experience to know how to treat the patient correctly. By the end of this placement, I want to be ready and explore more opportunities in this field, because this is what I enjoy doing, even though it's quite challenging.
It's been really interesting, really fun to spend time with these guys, but hopefully it'll be a really nice start to their career in physiotherapy and with the NHS.
Thanks James and Isabel, what a positive way to gain real hands-on experience. Well, that's it for this week. Don't miss any of our updates on the usual social media platforms, Twitter, LinkedIn and Facebook. And don't forget, when you get your invitation for your jab, be it a booster or the flu jab, please do take up that invitation. I'm going to be taking a short break now, so I will see you in a couple of weeks' time. Stay safe and bye for now.